The Faculty of Nursing at the University of Windsor is home to hundreds of undergraduate students interested in pursuing a career in nursing. The school's newly renovated facilities and uniquely designed clinical program are a big draw to the school. The clinical program at the University of Windsor is available to students of all years, setting it apart from most other institutions.
Students will be given an opportunity to implement the skills and the theory that they're learning in the classroom setting and have an opportunity in the clinical setting to demonstrate them. So it's really kind of connecting the theory to the practical setting.
Administration, staff, and students alike pride themselves on the opportunities for learning provided by the clinical program.
I think the clinical aspect of the program is really important. You're basically put into the hospital and are acting as if you're a real nurse, and you're interacting with patients daily and getting a real taste of what it's going to be like when you're in the hospital.
A recent flu outbreak at local Windsor Hospital Hotel de Grace posed significant risk to students and the program. Students designated to practice at this hospital were quickly moved to other clinical locations due to the threat associated with the outbreak.
Once it reached the outbreak status, Hotel de Grace Hospital decided that they were going to stop students from actually going into that setting for that period of time.
Staff and administration were quick to accommodate students affected by the outbreak, regardless of the rapid advancement of the issue.
It was kind of all of a sudden that they heard about this flu outbreak, and so they moved the people who were in that clinical placement to a different hospital. So I know they tried to accommodate them as best as they could.
Occurrences such as the flu outbreak are not rare, and the program has worked diligently over the years to become adept to such situations, expecting to contend with them from the get-go and planning accordingly. Students are required to have up-to-date vaccinations prior to the start of the program, so in situations such as this do arise, faculty, staff, and students can respond in an appropriate and timely manner. Networks of people from the school to hospital staff work carefully to ensure that the program runs smoothly. Experiential learning through clinical study and new technologies such as simulation labs are a focus of this program, as they allow students to learn and make mistakes in a safe environment. Students have voiced concerns over the workload of the program, but have hopes that the university will take note and work towards future improvement.
One thing that I found about the program is that it's really heavy and there's a lot of work and it's kind of overwhelming, so there's any way that they could lessen the course load or maybe made the program 5 years instead of 4 so that we could actually retain the information rather than cram and then forget some of the stuff that we've learned.
Faculty members working cohesively and emphasizing student-centered learning continue to aid the University of Windsor's growing nursing program, and staff have faith that the unique opportunities and technologies they are able to provide will encourage the program to develop further. Madison Seeger, the 30.ca.